Hi, my name is Dr. Brian Prax and I practice brain-based therapy. My wife, Dr. Jennifer Prax, and I have been practicing for 15 years and helped literally hundreds of people with fibromyalgia and other chronic conditions. Today I'd like to talk about fibromyalgia. What are the causes? What are the treatments that we provide here? Fibromyalgia, definition. Basically it means you have pain all over, you're chronically fatigued. Many of my patients feel like they have the flu 24/7, 365 days a week. The problem is with fibromyalgia is there's no real lab. There's no MRI, blood test, CAT scan, or anything that the doctors have or that we have to definitively diagnose fibromyalgia. Usually it's a rheumatologist who diagnosed 11 out of 18 so-called trigger points that are tender, and you're diagnosed with fibromyalgia. But many times my patients report to me that doctors will say that they think it's all in the patient's head, or they're faking it because there aren't any labs. It's a really misunderstood thing. But we do know what's going on, and I want to share this with you. So fibromyalgia is a neurological thing. So when doctors say it's in your head, it really is in your head. Let's talk about it. Mostly it has to do with brain and brain stem. There's three parts to the brain stem. One is the upper brain stem, known as the mesencephalon. Second part, the mid part, is the pons, and the lower part of the brain stem right here is called the medulla oblongata. So how does it work? Well, input from the body comes into the brain, which then fires or sends impulses down to the medulla, the lower part of the brain stem here, which then fires information or impulses up to the mesencephalon, the top part of the brain stem. And what the lower brain stem does is it puts the brakes on the mesencephalon. We're going to learn a lot about that, but it slows or inhibits the mesencephalon. Why is that important? We'll discuss that. Basically, lower firing or lower impulses into the brain comes from emotional, chemical, or physical stresses. Most of the time, or many of the time with fibromyalgia, it's an emotional stress that can trigger this. It can occur from being abused sexually or physically, maybe verbally. It can come from financial or stress or divorce. It can, of course, be added to or come from a person who has smoked or is smoking, from alcohol, or other types of severe stress. This type of stress, as I mentioned, decreases firing to the brain, which decreases firing to the lower part of the brainstem, which doesn't allow or inhibit, it doesn't slow down the mesencephalon. When that happens, that causes the adrenal gland, way down here through a nerve, it causes the adrenal gland to release more stress hormones, which cause those pain fibers to become excited and causes pain all over. What do the MDs do? Well, their treatment is, let's try a Russian roulette of medications to see if we can stop some of these symptoms or decrease some of these symptoms from occurring. The mesencephalon, as we talked about, that's the area that controls your sleep centers. So a lot of my fibromyalgia patients tell me that they sleep about 2 to 3 hours and then bam, they're awake. There's also this fibrofog, this area where you don't exactly feel like you're clear on your thinking, where there's something on the tip of your tongue and you just can't quite get it out. So that's fibrofog. So when we do brain-based therapy, which we'll talk about in just a minute, it actually decreases that fibrofog, or it lowers the fibrofog, so it allows people to start thinking sharper and clearer. Irritable bowel syndrome, that's another symptom of fibromyalgia, coming again from the mesencephalon, connected through the vagal nerve. Dizziness, another common area, another common complaint of fibromyalgia, comes from brainstem cerebellar area right there. The cerebellum controls balance. The cerebellum controls the spinal postural muscles in the neck, mid-back, and lower back. When this is overfiring the mesencephalon, we get tight muscles. This can cause back pain. It can cause sciatica, that nerve pain that goes down the leg. The heart is controlled by these areas too, and this can cause arrhythmias and other heart conditions. So we end up chasing all of these symptoms. So what do? What's different about us? Well, first of all, we use this thing called brain-based therapy. And let me stop right there and give credit where credit's due. I learned this from my mentor, the author of this book, Dr. Michael L. Johnson, who wrote the book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. First of all, get this book. Really, really good. It's written for the layperson. I actually use it a lot. It's a great book. He is a board-certified chiropractic neurologist who gets the brain and what's going on. One of the things that we do, we first analyze to see if you've got these brain issues that we're talking about. And then we start by activating the brain, literally retraining the brain as a physical therapist would do to retrain weakened muscles. We can find weakened areas in the brain and retrain it. You can actually get brain tissue to grow. We use oxygen. Oxygen concentrators we have here in the office deliver the fuel that the brain requires. The brain requires really two things. Fuel, which comes in the form of oxygen, and fuel, which comes in the form of glucose. We'll talk about glucose in a second, but that comes from the diet, which is critical also. The older we get, the lower our body's ability to utilize oxygen becomes. So we do oxygen therapy here. We also do oxygen while you're on an upper body ergometer. The upper body ergometer, a bicycle for the arms, activates the brain, gets the brain firing better while breathing oxygen at the same time. We may do vibration therapy. It's really simple. You're on a vibration plate which increases the activation of the brain. So, brain-based therapy is taught by Dr. Johnson. We may also use unilateral adjustments, that's single-sided chiropractic adjustments using a handheld instrument called an activator or a computer-assisted adjusting. There's no popping and no cracking. We have to be very, very gentle with the fibromyalgia patient. We can overdo it, so we go really, really gentle. We may use other forms like olfactory stimulation, which is breathing something in on one side as compared to the other side to bring up areas in the brain which aren't functioning as well. We can rebuild the brain by doing that. We may use warm calorics, putting warm water in the ear, which increases the activation on the low activating side. The other thing that makes us different, and I think is really critical, is we actually run laboratories. It may be a blood, it may be a saliva, it may be a stool, whatever it takes, but we need to make sure that you don't have an autoimmunity such as diabetes, rheumatoid arthritis, celiac, or gluten insensitivities or autoimmunities. There are sensitivities to foods. We need to make sure we rule out gluten, lactose, milk, soy, eggs, yeast. Some of these things that you're eating may be causing or leading to or not helping the fibromyalgia. What else do we do? Well, if we find through our testing that your liver, for example, or kidneys, skin, colon, is having a tough time detoxifying or cleansing themselves and cleansing the body, we may need to run a cleanse. It's analogous to taking the filter off of the car on an oil change. What the mechanics do is they throw that away and put a new filter on. Well, we can't do that with our liver or our kidney. So what we can do is we can run a cleanse to cleanse out your body. And a lot of times I've seen the cleanse alone gets fibromyalgia patients significantly better. Other things that we might do, we work with a medical doctor who might recommend a fast. A 2-day fast a lot of times resets the metabolism and gets things started. I'll have a medical doctor who's on my team. He's a board-certified endocrinologist medical doctor. As part of the fibromyalgia package, this medical doctor will analyze all of your medications and all of your supplements to see if any of those may be leading to some of your fibromyalgia symptoms. So in summary, what makes us different? First thing that makes us different is you have a chiropractor who is certified through the Department of Medicine in Virginia working together with a medical doctor for you, working together. We run these sensitive labs, very sensitive labs, to rule out any of these autoimmunities that you may have or food sensitivities which can affect the nervous system. We do brain-based therapy as the things I mentioned to work on activating the brain and rebuilding the brain, which is where the problem's from. So we don't do any more medications. In fact, the medical doctor will usually take people off of medications. We don't have any special surgery for you. We work on fixing the problem at the root level. Instead of taking medications which are working on symptoms, which is kind of like pulling the top of the weed off, what we do is we work on getting the whole root out, and then we teach you how to keep the root from coming back. At this point, I'd like to wrap it up. I appreciate you listening. I'd like to make you an offer. Because we're trying to get brain-based therapy out there and help more people, what I'm going to offer are the first 2 visits for free. The normal value for these, $300. First, I want to see if you qualify for the care. We run the neurological testing. I'm going to look at any labs, MRIs, etc. that you may have had done already. I'll do all of that. and we'll sit down, doctor to patient, face-to-face time, really see what you got going on and see if I can help you out. On the second time you come in, we will do a trial treatment. You'll probably get a unilateral adjustment. We might do some vibration. We might even introduce you to oxygen. We'll see where you're at and what the need might be. But we'll see if you might be a candidate for this type of care. So I'd like you to come in to see if brain-based therapy can help you out. I don't want to waste any more of your time or any more of your money. If we can help you, fantastic, I'll provide recommendations. If we can't, you're done, no obligation. Let me refer you to the next place that I think might be able to help you out. So please, help me to help you and help me to help others. If you are the one that requested the DVD for yourself, give us a call so you can set up your 2 free visits. The number here is 434-977-5433. Please stop letting fibromyalgia rob you of your health. Imagine, if you will, a life free of fibromyalgia. No more daily body pains, no more of this fibro fog, no more missing out on life, missing out on outings for yourself, for your kids, missing another day of work, and just living miserably. Please just pick up the phone and give me a call. Once again, my number is 434-977-5433. After this, I've attached some testimonials for you. These are real live patients who were skeptical at first. But like many of our new patients, they gave it a try, and you get to see their outcomes and hear it from themselves. So just listen to their stories. Give me a call. I can help you. I look forward to meeting you really soon. This is Dr. Brian Prax. Have a great day.